Let's go ahead and get started. My name is Sanjay Nasta. I'm the CEO and founder of MicroAssist, and with me I have Linda Warren. Linda Warren leads our e-learning department and is our head instructional designer at MicroAssist. We are going to talk today about why you should care about public-facing training. So the first step is starting out with a description of what public-facing training is. What we're talking about is training that's available to people who have a connection to your organization, but who are not your employees, external stakeholders. In fact, they may never set foot in your facilities, but you want them to change their behavior in reference to something you care about. So why should you be interested in public-facing training? As with training internal to an organization, public-facing training is driven by some sort of organization goal. There is some sort of behavior that you want to change in people outside your organization. That behavior change will result in making your organization more successful. So let's talk about, the first step when you're starting to design training is to think about who your audience is. So you might be wondering who your potential external audience is. Who you want to reach kind of depends on your industry. So let's go to your chat window and add some comments on some of the industries that you're trying to reach and some of the audiences that you're trying to reach. So go ahead and type some of them out, and Linda and I can talk about some of the people we've typically used public-facing training for.
And I know when we design public-facing training, one of the things we think about is the audience is typically a lot larger than it is when people design training for the internal audience. Internal, you pretty much know your employees. It might be a relatively homogeneous group. But when you go outside, you have the potential to reach many more people. And it also is often a more diverse audience than your internal audience.
Some of the audiences that we have reached with public-facing training is a lot of people out in the healthcare industry. A couple of our case studies that we will go through will show you external stakeholders in healthcare industries, including people who are sick and family members and the clinicians that treat them. Is actually our first case study that Linda is going to go into. We've also reached external customers for manufacturing, and one of the case studies is Rackspace, where it's an external customer in IT, and the result of that is lowering customer support costs.
Okay, so the way that we're going to go through and demonstrate what you can do with public-facing training is by showing some case studies. And the first one was some training that was done for the Texas Department of State Health Services. And Test Texas is an initiative to make HIV testing routine in an effort to diagnose people who are HIV positive but don't know it. And in fact, 1 in 5 people living with HIV don't know their status, and that's a problem. It's a problem for a couple of reasons. Number one, because they're not getting the medications they need to maintain their health. And number two, if they don't know they have the disease, they're not changing their behavior in ways that can reduce the spread of the infection. And that's a big problem. So people are not being tested for a preventable disease. Now, if you're the state agency responsible for the health of the people living in your area, what can you do? Well, the Texas Department of State Health Services, or DSHS, provided training to clinicians on HIV testing. Now, these clinicians don't work for the state, but the state agency wants the clinicians to change their behavior, so that's why we're calling it public-facing training. And that behavior change that they want is they want more people tested for HIV. Now, through research, DSHS knows some of the barriers to HIV testing. And one barrier is that some clinicians think there's a stigma associated with HIV testing, and they don't want to offend their patients. So the training dispels myths, and we let them know that, in fact, approximately 70% of the population says that their peers wouldn't think differently about them if they knew they had been tested for HIV. And the training goes on to let clinicians know why people get tested so they can use that logic when they're bringing up the subject of testing with their patients. DSHS also knows that it's common for clinicians to believe that the patients they see aren't at high risk for HIV, and so the clinicians think that testing their patients isn't important. So we dispel that myth with a true story. And we start that with a movie, but because of streaming issues, we can't show the movie here, so I'm going to try to simulate that with slides. So what we say in the training is that the opt-out approach to HIV testing has been implemented successfully at a hospital in West Texas. A 40-year-old man arrived at the emergency room with chest pains. Now, a significant thing here is he comes in with chest pains, so it's not a symptom that you'd be alarmed or think that he might be HIV positive. And his preliminary workup included an HIV test as a routine part of patient care in this emergency department. The result was positive. Even though this man had been involved in risky behavior, it never crossed his mind that he could be infected with HIV. When his wife arrived at the hospital, he had to tell her that he was HIV positive. The wife asked to be checked in, and she was tested. A little while later, the emergency department physician had to let the woman know that she was also HIV positive. And he said it was a really tough time for everyone. But the patients were grateful for the life-saving care that they received as the result of the routine HIV test. So we use this to draw people into the training, and then we ask, do you know the best way to inform patients about HIV testing? So we've got a question now for people who are participating in this webinar, and we'd like to see your thoughts in the chat area on what this kind of training can achieve. What did it do for the organization? What did this training accomplish for the Department of State Health Services? So go ahead and type your answers in the chat area. In just a second, I'll start mentioning some of the things that we felt we accomplished with this training. Sanjay, do you want to comment on any of the things that we accomplished with this?
Well, educating the general public is one of the things that is a mission for DSHS, and I think this training definitely helped drive that in a very measurable way.
So, we thought that we created awareness that there was a problem with this training that maybe the target audience wasn't aware of. We let the audience know that they could do something about the problem. The training dispelled some myths. It let the audience know how to implement the desired behavior. And it enabled DSHS to carry out their mission by improving the health of people in Texas. So here's another case study, and we've done actually quite a bit of training for the Department of State Health Services and around HIV. So the second case study is on HIV also. And we thought this one was significant because it shows how public-facing training can have a monumental impact on public health. And this particular training focuses on preventing the transmission of HIV from an HIV-positive mother to her newborn child. And this is the problem. There are some women who don't receive proper health care during their pregnancy, and some of those women are HIV positive, but they don't know it. A baby born to an undiagnosed HIV-positive mother has about a 25% chance of contracting the virus. And if the mother breastfeeds the child, the chance of transmission increases beyond that. And because the Texas Department of State Health Services knows the transmission rate can be decreased, they want to train clinicians on the importance of testing pregnant women for HIV and starting treatment as soon as possible when there's a positive diagnosis. So here's what's included in the training. If a woman is treated with ZDV, which is an accepted and effective treatment for HIV during pregnancy and labor, and the baby receives HIV medication for 6 weeks following the delivery, the rate of transmission can drop to 8%. And if the mother is treated during pregnancy and has a cesarean delivery, and that choice would be made based on her viral load, and the baby is treated for 6 weeks, the rate of transmission drops even lower to 2%. And there are even better results when the mother receives triple therapy during her pregnancy, IV ZDV during labor, and her baby is treated for 6 weeks. Then the rate of transmission can drop to lower than 1 to 2%.
So think about the impact of this public-facing training. For a baby born to an HIV-positive mother, it reduces the chance of having HIV from 25% to less than 1 or 2%. That's really significant. What if that baby was you? Think about the impact of your life being born without HIV compared to living with HIV all your life. Think of the cost impact to society. That's one of the reasons Microassist is passionate about public-facing training. We know it can have a significant positive impact on society.
Okay, so now we're going to shift gears and have a case study on a different topic and for a different purpose entirely. So if you're involved in rapid e-learning development, you're probably familiar with the company Articulate. They make rapid e-learning development tools, and they provide lots of training on their products. If you use Articulate Presenter or Storyline, you probably recognize their training portal. You know that they have lots of job aids and videos that are really terrific. They go through step-by-step procedures on how to use their product. They also have forums where their product support specialists and community members get answers to questions about how to use the product. And this allows users to get answers to their specific questions, so that's hugely valuable. Beyond that, Articulate has a community blog with productivity tips. So why would Articulate want to train people on how to use their products? They've already sold that product. So if you've got some insight on that, go ahead and type your thoughts in the chat area. So what we really want to know is, after they've sold their product, why would they be interested in providing public-facing training? They've already made the sale.
So we got one answer of higher customer satisfaction, and that's definitely true with Articulate.
And I think that higher customer satisfaction results in customer loyalty. And customer loyalty can do a couple of things for you. If customers like you, they are probably more likely to buy other products that you offer. And they'll most likely buy the next version of your product rather than switch to another vendor. And what Articulate knows is that it's easier to keep existing vendor or customers than to gain new ones.
And Kathy, I agree. One of the things that Articulate does really well is they support and train their customers after the sale. And a good side benefit from them is that it lowers their customer support costs, but also creates a really good feedback loop in terms of new products they need to have, and encourages their community to also create add-on products for Articulate. So if you go to the Articulate community, one of the things they'll highlight is add-on products that people have created and often give away for free. Characters are an example. Graphics are another example.
So I think that Articulate is a great example of a company that uses public-facing training to achieve their goals and improve their business results. So are we ready to move on to the next one, Sanjay?
Sure.
Rackspace is one of our clients. They're an IT company that provides data storage to their clients, and they sell their services through channel partners. So when Rackspace has a new offering, they want to let their channel partners know about the features, the benefits, and the selling points of the services that they're offering. And we know it's in Rackspace's best interest to provide the training to their channel partners, because if channel partners don't know about the products and services, they can't sell them. So when they're providing information about features, benefits, and selling points, what does that sound like to you? Does it sound like Does that sound like training? If you've got an idea, you can type it in the chat area. But I kind of think it sounds like marketing, because marketing involves informing customers about products and services. So in this regard, marketing and training are similar because they're both trying to change a behavior. When you're marketing, the desired behavior change is to make a purchase. And when we think of employee training, we're often thinking of a different kind of behavior change. For employee training, we're increasing knowledge or improving a skill and ultimately improving on-the-job performance. The point is that training can do some of the things that you might typically try to accomplish with marketing.
And Laura, you're right. The ultimate goal of marketing is actually driving sales. And one of the problems that we're facing right now is that people have kind of tuned out a lot of advertising. When companies are thinking about marketing or advertising, they always want to know how effective it is. Well, right now we're bombarded with advertising messages from the time we get up in the morning until the time we go to bed at night. Depending on your source of information, and experts say we're exposed to anywhere from 247 to 3,000 commercials each day. And, that overwhelming exposure has got people to start tuning it out and use technology like DVRs and ad blockers to start tuning messages out. Another challenge that marketing faces is that it works really best. Traditional advertising works really best when the message is strong and emotional, but to convey a deeper message, the audience won't pay attention for very long. At best, you can get your audience attention for a few seconds as they walk by the TV set.
So if people are tuning out marketing, how can you get your target audience to pay attention to you and what you have to say? That's where training can be effective. When you provide training, you offer knowledge and the ability to acquire skills, and in exchange for that knowledge and skills, you get the attention of your target audience. With training, you can extend the time you have the attention of your audience, and you can create greater awareness of your product or services. We mentioned previously that public-facing training and marketing have some similarities. When you're educating customers, you see some of the differences. When you take a training approach, you go into greater depth about features and benefits of what you have to offer. You might get more into how to use your products and services, and you increase the target audience's knowledge and thereby offer value to your customers. You're moving yourself from sales to a trusted advisor or expert. You want to be a trusted expert rather than a marketer because people don't trust advertising. People trust people they know significantly more than they trust any form of advertising. With marketing and advertising, you want to reach people you don't know. Online public-facing training can help you establish a relationship as an expert or a trusted advisor with people you don't know. It allows a business to scale up training and reach a much wider audience.
So one of my first exposures and the first thing that got me thinking about training as marketing was Home Depot. When they opened up, they started doing free workshops in their stores. Home Depot built its reputation on making home improvements easy. So doing free workshops was pretty aligned with that goal. Part of the marketing strategy was also to use in-store classes to show how easy it was to fix and improve your house, and to draw customers who were ready to improve their house into the store. So I have a 6-year-old, and one of his favorite things to do on the first weekend of every month is to go to Home Depot's free kid workshops. And you get there early Saturday morning. They treat both the kid and the parent very well. They give him a free apron, a free kit to build, a pin to pin if he builds the kit and paints it correctly. They feed him with hot chocolate and snacks, and then they clean up the whole mess so that I don't have to. Obviously, it's building their brand and it's building loyalty. And somehow, since I'm already there on Saturday morning, I tend to pick up a few supplies to get household chores done on the weekend instead of going to another store. So it's a brilliant use of using training as marketing. And one of the things as Google is changing to value higher quality content over link farms and links, um, Home Depot thoroughly understands the concept that training is high quality content. I kind of did a quick check, and there is almost 37 million links to Home Depot's workshop pages. 36 million of those are from external sites, not Home Depot's internal sites. Home Depot obviously values workshops as advertising. If you look at the top in the yellow area, they're spending expensive Google ad dollars to advertise those workshops. Home Depot also understands that training and educating your customer can be part of a great social media strategy. Training is, again, high quality content. People value it, people watch it through to the end. I don't know if you guys know that, but YouTube is the #2 search engine out there, and Home Depot uses about 30 associates part-time, 2 out of 5 days to create its content. Now, it's kind of an interesting strategy because the other 3 days those associates are on the floor talking to customers, so they have a pretty good idea of what kind of content those customers want. And 2 days a week, they go off and create contents and videos. They already have 6,000 posts in 2 years and hundreds of videos that were viewed in over 30 countries. And you do notice that at the top of the YouTube channel, again, they're advertising their specials. And this was a promotion, I think, earlier this month or last month about Black Friday is back, pretty much for all the people in Texas who are starting to garden. Robert Cialdini is a professor that has done a lot of work on how to influence people. And he is a professor that Warren Buffett and Charlie Munger recommend every year at their shareholder meeting. And his quote is, "The tendency among humans is that we want to give back to those who have given to us." And that's one of my views about training. Training is a pretty reciprocal relationship, unlike advertising. Advertising basically takes time and hopes that you buy. In training, you are providing value to your customers, and generally you create a feeling of trust and a positive feeling for your brand.
So here's a list of 7 things public-facing training can do. We've gone over some of the things in the case studies that we've presented here. And what an organization can accomplish with public-facing training depends on its industry sector and its goals. Now, we've covered a lot of these, but not everything. One of the things that public-facing training can do that we didn't get into too much was cut costs. We did some training for the Health and Human Services Commission. They have a program, it's an incentive program for physicians who use electronic health record technology to document their patient visits and patient data. And for physicians who see a large portion of Medicaid patients, they can apply to be in this program and receive an incentive payment. And the portal where they fill out information is somewhat complicated, and people have trouble filling that out. So what Health and Human Services found out was that they had a lot of people staffing a help desk, and they had people whose job was not primarily to staff a help desk, and those people were not getting their primary job done. So we provided public-facing training so the people who needed to use the portal could get trained on how to use it. In fact, there are simulations. So people go through using the portal, they see the kind of information they need to have when they go there to fill it out, and they go through and they answer the exact same questions that they'll fill out when they use the portal. So that's an instance of public-facing training cutting costs because Health and Human Services now does not need to have as many people staffing their help desk. I think we saw examples of carrying out your mission and improving society with the work that the Texas Department of State Health Services does in reducing the transmission of HIV. I think Rackspace was a good example of increasing exposure to products and services, and Articulate was an example of creating customer loyalty and educating customers. So I think those are really powerful things that organizations can accomplish with public-facing training. So here's a pie chart based on research that Brandon Hall Group did in 2012. And what they found was that nearly half of all the organizations they surveyed had some form of external training. So I think many organizations realize this is a very large and powerful thing. And I think we're going to see more and more organizations thinking about their external audience, the number of people who are in their external audience, and the different kinds of external audiences they can reach. So, having listened to what we've talked about in this webinar, Sanjay and I are kind of wondering if anybody participating in this has thoughts on the way their organization can use public-facing training to support your business goals. So if you do, go ahead and type your thoughts in the chat area. We're just kind of interested to see what organizations in different sectors might be doing with public-facing training, or if they haven't started yet, what they might be thinking of doing.
And for me, the other important question is, what challenges do organizations have when they're thinking about public-facing training programs? And we're going to cover some of that in our next speech, but it'd be great to start a discussion off that here.
So what we talked about today is sort of the why behind public-facing training, why organizations might be interested in it, and what can be accomplished. At the e-learning symposium in June, we've got another presentation on what makes good public-facing training. And so there we'll focus on sort of differences between training for an internal audience and an external audience, and we'll look at examples of what organizations are doing and what makes their training effective. So if you're interested, it would be great to have you join us on June 12th for that event.
Well, let me talk a little bit about e-learning symposium. E-learning symposium started basically as a way to improve the quality of e-learning out there. When it started, there weren't a whole lot of organizations, especially in Texas, that improved the quality of e-learning, and it was a group of 40 people that kind of organically started it. And we started doing meetings, and almost organically we decided to have a conference about once a year to just get all these people together that were interested in it. It's grown to 2 conferences a year. We just finished our conference in Houston, and now we're having another one in Austin. I'm really excited about the conference in Austin. 1, I'm not speaking. 2, Linda is. That means I can sit back and enjoy it for once. I got to MC the conference in Houston. We have some world-renowned speakers showing up in addition to Linda. We have one of the best folks on mobile learning giving a workshop. RJ Jacques is giving a workshop at the conference called From E-Learning to Mobile Learning. And mobile learning is one of the hottest areas out there. So Linda and I both took that workshop, and it thoroughly advanced our practice of mobile learning at Microassist. We also have a lot of stuff on what the future trends are in learning, and we have a panel discussion on that. One of the things I like, because I can grab information so quickly, is infographics, and we have a topic on how you create infographics and use them in training. And we always try to put one really cool training in there. And we have a workshop from the San Antonio Zoo on the augmented reality and 3D graphics. We are just about through with early registration. It finishes on Tuesday. So if you want to register and save a chunk of money, this is a good time to do it. You can go to els.elearningcouncil.com and register. If you have any issues registering, just shoot us an email and we'll be glad to help you out on that.
So public-facing training is a topic that I think is pretty interesting, and Sanjay and I both enjoy discussions about this topic and other things related to e-learning and mobile learning. So if you've got any questions for us, we'd be glad to talk with you further. Shoot us an email, give us a call, and we'd love to share ideas and know what you're thinking. So I think that pretty much covers what we were planning on discussing today. So we thank you for joining us, and we hope you'll join us for something else in the future and possibly see you at the e-learning symposium.